Hi, good evening. This is Dr. Michael Krevolin with Capital Health Primary Care in Yardley. This is our Facebook Live session here to talk about seasonal allergies. I'd like to thank Rebecca Kelly and Alex Brown for their help in organizing this event and providing us the opportunity to talk tonight. And I will be fielding some questions and hopefully providing a helpful overview of some common signs, symptoms, treatments, and fielding any questions or concerns you may have over the next, let's say, 20 to 30 minutes. So let's see here. All right. So I don't see the comments coming in yet, or the questions. So let's see, you'll have to forgive me. This is my maiden voyage on Facebook. All right, so let's see if we have anything set here. I don't see any, but all right. Okay. So if you're out there, we'll just begin with some basics. So seasonal allergies, we're going to try to keep it within the scope of seasonal allergies. Um, Basically, we'll talk a little bit about pollinosis, or otherwise known as hay fever. Um, and pollinosis is basically when your body identifies a foreign substance. Oh, okay. Oh, some people coming in here. Let's see. All right. So feel free to forward any of your questions in, and I'll try to answer everything I can get to in the time permitting. Um, so anyway, seasonal allergies. It's a wide scope. You know, why people want to know why do allergies manifest in some people and don't manifest in some people. Sometimes within the same family. And seasonal allergies are not necessarily hereditary. The allergy per se. What is hereditary is an abnormality in how your body identifies foreign particles. And it also can be due to carryover from a weakening of the immune system, which can make you a little more susceptible to reactions. Um, and this can vary in many different kind of symptoms in many different ways with a variety of helpful treatments that, again, just like the allergy itself, may affect people differently and may need to have their treatments individualized. So talking about the different allergies, we talk about break them up kind of in season. And right now in the fall, we are in the midst of ragweed season. And as we get into the winter, we get into the colder months, we start putting on the heaters. Then we're a little bit more susceptible to high dust counts. As we go into the spring, that is usually, in the transference from the colder months to the warmer months, we see a very steep increase in pollen counts. And another question somebody had asked me was a little bit about how do we know, how do we know what to look out for, and how do we know in our own local neighborhoods or districts what to look out for? And you can look in the EPA has a good print out for all the pollen calendars, when to expect certain rises in types of pollen, and also will give you a count. So just like looking for certain climate changes like temperature, humidity, barometer pressure, you can also look at pollen counts. So that's a good way to kind of prepare yourself for the different changes that you can anticipate happening as the seasons go along. So getting back to it, this spring, as things warm up, you'll see a steep increase in pollen counts. And in the spring is when you're going to see your grasses and the trees and all that kind of stuff, which people usually get the highest reactivity from. And it's usually from about April, late March, early April to June is when we start to see that. And in the summer, we get a lot more moisture, humidity. You'll see a lot more of the molds. They will come into play. Um, things to keep in mind at that time. In certain climates, like if we lived, some of my patients that are from Central America and places where they really don't experience those, corresponding weather changes, they won't experience as much of the allergic reactivity due to the lack of increase in the pollen counts. Um, that being said, so that's pretty much the calendar there of the different allergens that you'll see. And again, an allergen is basically a foreign particle that your body identifies as a foreign substance and kind of has an overreactivity to its presence in your body. And there's a couple of things that happen. And without getting too deep into the pathophysiology and the science behind it, your body reacts in a way to release certain inflammatory markers, which may cause you to have those typical allergy symptoms. When we talk about hay fever, pollenosis, it's the increase in inflammation, such as the nasal congestion, the itchy eyes, the runny nose, things like that we often see. And a lot of the culprits there that we look at are certain things like histamine. And histamine receptors are found on cells called mast cells. And when the allergen comes in contact with your body, what your body does has a vetting process that kind of looks to different sources and kind of identifies the specific particle, and it goes through, like we said, a vetting process where your body starts to produce what are called antibodies, certain proteins that are built to help basically do a counteract to the foreign particle. And in a way, it deploys what you could kind of call like a little bit a backup of soldiers to attack the certain allergen. And in a way it does that, it causes an inflammatory process that can cause those specific symptoms that we discussed. Now, certain ways to help decrease these symptoms, there's certain ways to help prevent these symptoms. And that's kind of what I wanted to touch on a little bit tonight. And also really spend a little bit of time discussing the safety of some of these medications, over-the-counter medications, as well as the prescription medications that you may be prescribed by your doctor. So when we talk about certain things, I know one question was about, itchy eyes, swollen eyes, and red eyes, okay? Is it an allergy? Is it something else? And these are things that, we think about, okay, we have a reaction and we kind of want to really figure out the underlying cause before we start treating. Sometimes it's not possible. And in some cases, the most effective treatment against any allergies are trigger avoidance, trying to identify what it is that causes the allergy, and from there, being able to avoid contacting that. So, when you have itchy eyes, you think, oh, they get dried up, maybe artificial tears will be helpful, prescription versus non-prescription. I always am careful when prescribing medications with the eyes. But you have certain medications that act strictly for allergies and work on those histamine receptors, like the antihistamine, and you have your regular artificial tears to help lubricate the eyes. But you also want to, be in contact with your doctor, because it may not be allergies. It may be something like a conjunctivitis caused by, certain other viruses that may not be involved with allergies. So those are things that you kind of want to keep in mind. But with some of the medications that you have, a lot of these medications, eye drops included, and especially a lot of the nasal sprays. When we get these symptoms of congestion, sinus congestion, the first thing we just want to breathe. So we seek out anything over the counter that we can, which again is that's just in our nature. So a lot of the preparations that are out over the counter may seem harmless, but can actually be, depending on your medical history, and that's always a caveat for any of these situations, especially when we're talking about certain medications like your nasal sprays, especially medications like Afrin or any short-acting nasal sprays. So the most common, I'd say, three types of medications for nasal sprays that are prescribed would be your typical decongestants. You have your Afrins, and there's Mucinex severe sinus. There's a bunch of different types. Um, you also have a few types of intranasal steroids that work to directly decrease the inflammation, like the fluticasone, Flonase, things like that. And you also have different types of steroids, like Medicine, which is used in Nasonex. So the things you want to watch out for are, you know, uh, basically the length and the duration of how long you want to use these medications for. In a lot of what we call allergic rhinitis, or when you get inflammation from an allergy in the nose, you want to use, something short acting, maybe for just a day or two. The medications like Afrin. And the key ingredients you want to look at here are medications, ingredients like phenylephrine or oxymetazoline. Now, these medications and these ingredients can basically, what they do is, instead of the intranasal steroid, which can help to decrease the inflammation in the sinuses and in a way there resolve the congestion, the more short-acting medications like Afrin basically constrict the blood vessels. And while they're constricting the blood vessels, it increases the lumen diameter, so it allows for a wider area for you to breathe. And it also decreases the fluid production, so you're not going to have that runny nose and those associated symptoms. Now, like I said, this is exactly what you want to do, especially if it's in a short-acting period. You don't want to use these medications for more than 48 to 72 hours, or about 3 days. What will happen, especially with these nasal sprays like Afrin, is you'll get what's called rhinitis medicamentosa, which is basically just a fancy name for rebound congestion. After a couple of days, what will happen is you won't get the effectiveness will start to fade, and you'll get the rebound congestion. But due to the constriction of the vessels, medications like Afrin and the ingredients oxymetazoline and phenylephrine, you will get a steep increase in your blood pressure. So I've had quite a few cases where person with allergies, we go over all the medications, but for some reason, and they didn't have a history of high blood pressure, their blood pressure is through the roof, and we can't figure out what's happening or what the underlying cause of the blood pressure is. They end up going on some blood pressure medications, and come to find out that they had just been using these types of nasal sprays on a chronic basis. And that's where you can, run into problems. Heightened anxiety, everything that you'd get, increased heart rates, things like that. You just really want to be careful of. And basically, when you're speaking with medical professionals and you're going over your medication histories, be sure to include all of the over-the-counter medications that you might be taking as well for, problems that you might not see as your chronic health issues, like allergies, seasonal allergies, for instance, supplements, certain medications like that. A lot of them don't undergo approval by the FDA. Therefore, a lot of the ingredients and potential interactions with your other medications may not be known. So, if there's one important take-home fact that we could do is that would be the one take-home message, is to really be dutiful in reporting all the medications that you're taking to your doc, because, like I said, even some of these over-the-counter preparations, you can have some difficulty with that. But anyway, getting back to the nasal sprays. So the short-acting medications should be used only for the short-acting duration, 3, 4 days. If that's not effective for you, you should go back or call your primary or your ENT, whoever it is, and let them know, because there may be a mechanical obstruction that may be independent of what actually is going on that you perceive as the seasonal allergies. Medications like intranasal steroids, while they do potentially have, like any medication, side effects, um, one common thing that people ask is, well, the intranasal steroid affect my blood sugar, in diabetics especially. While there hasn't been any proven studies to show a dramatic increase, it's something that you want to monitor and make sure it doesn't have nearly the systemic effects that an oral steroid would have. It is still a steroid, and you're still putting it in your body, so you just want to be mindful of that as well. But these are medications that are indicated, especially for these conditions, for allergies, specifically the fluticasone and the Nasonex. Both are, can be used for the allergic rhinitis. Flonase or fluticasone is very good in that it also works on all the pollinosis symptoms, so the itchy and watery eyes, the runny nose especially, and the sinus congestion. Nasonex is also steroid, but instead of the fluticasone, using mometasone, and that can be really good if you start to develop nasal polyps, which can obstruct and give you some congestion as well as a result of some persistent allergies. So again, just to review a little bit of what we had talked about already, the allergies are basically due not necessarily to inheritance of the allergy passed down from the family, but it's due to a dysregulation in the signaling and in the immune system, possibly some weakness in the immune system. Still not an exact science what causes it, but we just want to, be mindful about what potential triggers are and how to identify them. Another big factor and a big topic that people were speaking of was, how do I tell the difference between COVID-19 and my usual allergy symptoms, as both can have, a lot of overlapping symptoms, such as the cough and the congestion, headache, things like that. We're learning more and more about COVID-19 and some of the more common presenting symptoms. The sore throat, fever, things like that. Fever we don't commonly see in allergies, but let alone the name hay fever, you can develop a febrile process due to allergies. It's not as common, but it kind of would separate a little bit of the COVID-19 symptoms from your normal allergies. So fever is something that you normally wouldn't see in your allergies. Diffuse body aches and pains, things like that. Again, not as much in the allergies as you would see in COVID or flu type symptoms. You may get a little bit of aches and pains in the sinus area, but you shouldn't have tremendous back pain or weakness and things like that with your typical seasonal allergies. GI symptoms as well, the nausea, vomiting, diarrhea, you wouldn't see as much with allergies. Now, what you may see some vomiting if you have allergies, because if you have increased mucus production, a lot of the times if we're not expectorating and getting out the mucus, a lot of times we're swallowing it, and that can give us nausea type symptoms along with vomiting. So just to kind of put it out there, the big differences would probably be the GI symptoms, also mentioning the loss of taste and smell we've seen with some of our COVID patients, the persistent fevers, and things like that. So that'll hopefully differentiate a little bit of what you're seeing in both processes and how to differentiate one from the other. But again, if you've had contact with somebody or had some risk of exposure to COVID, it is important to notify your physician and talk about the utility of further testing for COVID. Okay, and so any other questions about COVID, please feel free to chime in there. All right. So basically, a few other things, questions that I was asked earlier today pertaining to this talk was about adult onset allergies. Some people saying, oh, I'm in my 40s, I'm in my 50s, I've never had seasonal allergies before. What would be the reason why I'm getting allergies now? Are they allergies? And, what is the underlying reason for that? And it's kind of multifactorial depending on what it is. I had a few patients come in and they were from the Midwest. I think it was Chicago, and they moved to Hamilton. And they said, you know what? I'm developing all these symptoms. I think I'm allergic to New Jersey. And while that may not be entirely untrue, you have to take into account certain aspects of your history. Have you moved? Are you in a completely different environment? Certain people, as their family, grows, they get pets, things like that. So, you may have certain exposures more recently that you didn't have before. There's another hypothesis out there called the hygiene hypothesis, which states that the less and less bacteria now that we come in contact with, it increases our susceptibility and in a way has deconditioned our immune system and may make us more susceptible as time goes on. Using these, and in no way poo-pooing the use of antibacterial hand soaps and things like that. But as they become more prevalent in society, we do see a decrease in our overall exposure to certain bacterium, and that could lead to us having less vigorous testing of our immune system. So that could also lead to prospectively more allergies as adults. Also dietary factors, things you may have changed, as well as types of ventilation. If you've, had different either heating systems, HEPA filters, things like that in the house that may have sprung on new onset allergies and things like that. Something to keep in mind. Okay, another thing that somebody had asked me was a little bit about allergy shots. So we talked a little bit about the nasal sprays. We talked a little bit about eye drops, and we'll get to the antihistamines and how they work as well. Um, so basically, allergy shots and what are they and what is their place in treatments? So for some people, the regular over-the-counter or even prescription antihistamines and home remedies, things like that, just aren't enough to really procure and settle and control their symptoms. A way to increase what's called the desensitizing of the allergens is to perform shots on a sometimes monthly basis, sometimes more frequent basis, depending on your specific allergies and your specific plan of care. And the allergy shots are given in a way to expedite your desensitizing, or a way for your body to kind of get used to, get accustomed to, and acclimated to the allergen, and also kind of endorse a response, an immune response to it. Now, some people would say, "Oh, shots, that doesn't sound too pleasant." And actually, in research for this, I had spoken a little bit with a few of the immunologists, and we talked a little bit about options, outside of using actual shots, and what has been developed, and it's not new, but it's new to some of the patients that I spoke to, are the allergy drops, which are sublingual drops. So they put them right under your tongue, and these are a good option for obviously people who don't desire having the needles, and if it works out and that's what you and your physician decided was an appropriate plan of care, especially for children, these are suggested, because it is found that the sublingual allergy drops have conferred benefit to developing asthma and is helpful in decreasing the potential for asthma in children. So that was one bonus for having the sublingual versus the traditional needle for the immunotherapies. So getting back a little bit to the treatments for your seasonal allergies. So as you know, there's tons of antihistamines out there. What there is to know is that there's two different generations of antihistamines that are used. Traditionally, the first generation antihistamines, your Benadryls, your hydroxyzines, these were used more off-label as well, not just for the allergies, but also for their sedating quality. So they don't, in effect, they'll help with your symptoms in the short course, but they can really be tough to tolerate in some patients, especially patients who are already experiencing some modicum of fatigue. So the first generations aren't used as much in your seasonal allergies as the current second generation antihistamines, which you guys would know as Claritin, Allegra, Zyrtec, Zysol, and the like, and the generics, of course. Now these are better because they do not have the sedating quality. They don't, not to make you as tired, and they are longer lasting. So they may be even more advantageous for people who take a daily antihistamine. Definitely much more tolerated. So things to look out for there. Probably the one with the least sedating quality is the Zysol. At 5 milligrams is known to cause the less amount of sedation and is proven to be just as effective. And these medications are known to be safe in pretty much most people with chronic diseases. And again, all of these things, you want to keep in mind your any other potential interactions, any over-the-counter medications, as we spoke of before, with blood pressure, with diabetes, and the like, any chronic conditions like that. And getting back to COVID too, there was a few studies done, and it was really no good studies to show that having seasonal allergies increases your risk of either contracting coronavirus or in the developing more severe symptoms due to your seasonal allergies. So you still want to keep in mind of those, especially the respiratory types of chronic diseases, the COPDs, your asthmas, and the like, with watching out for the severity of COVID. So antihistamines, relatively safe to take in all populations, especially the second generation. Another medication that's really helpful in the asthmatic component that might be seen with allergies. So we talked about antihistamines, and like we said, the foreign particle, or the allergen, is recognized by the body as basically an enemy, and it creates a protein called an antibody, which is then called IgE. It attaches on the mast cell and then releases the histamine, and the histamine is what causes a lot of this inflammation. Now, the antihistamine doesn't necessarily block, it just reduces the effects of the histamine being released. But there's another receptor called leukotrienes, which deal a little bit more with the respiratory or the breathing components. And some of the medication that you'll mostly be familiar with is called Singulair or montelukast. And that is a really good medication to help with any potential respiratory components. So if you have that, wheezy cough, or if you have like a lot of chest congestion along with your allergies, they work really well synergistically with your antihistamines in reducing your symptoms. Okay, so those are, a very extremely brief overview of the medications, some of the medications that we use traditionally in allergies. But some, I'm not a huge herbal medication fan, just because, like we said before, we don't really know exactly what some formulations are that you get over the counter in your herbal remedies stores, as there could be a potential for interaction with your medications. So, I was looking into some of the different foods and some of the different, seasonings and things that we, commonly see that might be really helpful in reducing our allergy symptoms. And, while some can be used acutely, like if you get the symptoms, you can use it. A lot are really good as just prophylactic measures in preventing symptoms. A big one is turmeric, which is known to inhibit histamine release, and that way helps to decrease a lot of the inflammation. So turmeric is a really good seasoning to use, especially in the morning, as well as green tea. Green tea not only has really good antioxidant properties, it also has helped shown to decrease a lot of the morning nasal congestion. That's a huge thing for like a lot of the people that suffer from a lot of allergic rhinitis or a lot of the stuffiness in the nose. Green tea is shown to be a really good preventative ingredient, as well as honey. Honey, a lot of recommendations. One of my earliest preceptors was really big on having patients obtain the local pollen honey. The locally grown, especially the buckwheat honeys, honey has been known not only as a good cough suppressant, but it's also been shown to allow for almost like a desensitizing process in the body in helping you adapt to the local pollens and the local allergen, or what your body would consider the local allergens in the area. But do keep in mind, we still, for young children, especially infants, we do not want to give them honey for fear of botulism and things like that. So you just want to be careful. And also, you're diabetics, you don't want to go crazy with the honey and have your sugar spike up. But it is good, for most people who can tolerate, putting it in the tea or adding it to a warm drink. It can really prove to be helpful. Magnesium-rich foods also are shown to be really good bronchodilators and helping open up your airways. A lot of the nuts, almonds, also very rich in omega-3 fatty acids, are shown to have a lot of anti-inflammatory properties as well. Salmon is included in there as well, as it helps to decrease a lot of the narrowing in the airways and can help with a lot of the respiratory components that we experience from more of the asthmatic or the allergic asthmatic components. Citrus fruits, especially vitamin C, and that's one thing I failed to mention. Vitamin C, IV therapy has been shown to be very beneficial in decreasing a lot of the respiratory components, histamine release, and the like. And cinnamon, cumin, black pepper are really good at preventing the congestion that we experience, as they increase the activity of these little fibrous little particles called cilia that help to purify and clean the air. Okay, and as far as certain skin allergies, so at times, some people can develop urticarial lesions or hives where they have just localized, raised, sometimes, well, usually itchy and sometimes pretty irritating lesions there. Certain natural remedies, aloe vera, oatmeal has been shown to have a lot of really good anti-inflammatory properties as well. So I know aloe, is really big for, any insults like with sunburn and things like that, but it can also be really good in your really itchy hive-like lesions. But obviously, if they become, too much to bear, then you would graduate to maybe, a topical steroid or something like that. if they get really, really bad. And also the first generation and second generation histamines can be really helpful, especially if you have, well, the first generation, if you have a lot of issues sleeping at night because of the itchiness, they can help to kind of take the edge off and allow you comfort as well as decreasing a lot of the inflammation there that you might see. Okay, let's see what else we got here. And so basically, when we look at certain environmental factors that may contribute, we touched a little bit on this here. The best, defense against allergies is trigger avoidance. But also, in today's, current state of affairs, with all the mask wearing, people ask, oh, is this good to help prevent allergies? Is this good, to go outside despite pollen counts and things like that? And the answer is yes, the masks are protective, but the most important thing you could probably do is wash your mask after you go outside to avoid any potential re-exposures from reintroducing any pollen or allergens back into your system. So that's one really good thing that you could do to help prevent the allergies. And another would be to, try to just limit, especially in the spring and summer when, there's a lot of, outdoor activities. You got a lot of trees and grasses, a lot of lawn mowing going on. So you just want to, be mindful of those kind of things as well. In indoors, especially, we talked a little bit about HEPA filters, things like that, to try to, clean the air in a way to prevent dust particles, the dust mites and mold and things like that, to help purify a little bit of your indoor surroundings. Especially in the winter when you turn on those heaters, you can be, very much predisposed to having reactions. Okay. And I guess the last thing I just wanted to discuss briefly, find that here, I made a few notes, okay, was the triad, the atopic triad. So a lot of things kind of run a little bit together. Your allergies, your asthma, your eczema, and overall, what you want to do if you take anything home from this is, avoiding the triggers, okay, and starting with some remedies that you may find helpful, that we talked about today, that don't include these more short-acting medications. So, to prevent the allergies, using those daily second-generation antihistamines, making sure that, your surroundings are free of allergen as best as they can be. And, certain allergy testing can be, pretty arduous and very involved and sometimes invasive. But if you find that these symptoms are not being adequately controlled with the over-the-counter treatments or with the antihistamines that you're using or your nasal sprays, that would be a time to consider allergy testing or speaking with an allergist or immunologist. But for all questions that you may have, you definitely want to address your primary care physician or your whoever is kind of oversees your care. And again, I can't stress how important it is, even if you are just taking the daily antihistamine or you are using some of these over-the-counter preparations. It's really important to confide in your primary care doctor or your allergist or whoever it may be, your cardiologist, and let them know even those over-the-counter medications or herbal supplements that you may be taking, because you don't realize they could have quite an impact on your overall health and potential interactions in your health plan, in your healthcare plan. Okay. All right. If there's no other questions, it was a great pleasure to participate in this, and I look forward to more sessions. And I can be reached at the primary care Yardley office here in Pennsylvania. And I want to thank you all for tuning in and look forward to the next time. Have a great night and stay safe.